According to Metro Public Health Department, Emily, they do not know each other. They do not know the first patient, so they were likely intimately involved with other monkeypox patients in another state or country, or people right here in Tennessee who haven't come forward with their monkeypox rash. That is the educated guess experts like Dr. William Schaffner are making, because this is a virus that 99% of the time jumps from one person to another when there is skin-to-skin contact. Very often, monkeypox manifests on the skin in the form of a rash, as you can see there on the hands, face, genitals, or rectum. Passing by or standing close to someone with monkeypox is likely not going to give you it. Dr. Schaffner says monkeypox is not classified as a sexually transmitted disease because intercourse isn't required for it to be passed on. However, in this global outbreak, many patients have reported their monkeypox infection appeared after a sexual encounter. Tennessee's monkeypox cases, they're not showing up on the CDC's map and case count. So I asked Dr. Schaffner why.
All local providers have been provided information about how to collect specimens appropriately and send them to our state laboratory. If they make the diagnosis of an orthopox virus infection, that's the name of the family, that specimen then is sent to the CDC for confirmation that it's really monkeypox. But we would take our state laboratory's positive result as virtually the same.
So there are vaccines, they exist, but they are being shipped to areas with much bigger outbreaks than ours. As for the smallpox vaccination people routinely got before 1972, the one that leaves a scar on your arm, there may be some residual cross protection against monkeypox, but epidemiologists do not know how strong that protection will be during this outbreak.
All right, Hannah, thank you. And of course, many of you may be asking, is monkeypox the next COVID? Well, most health experts agree that is not very likely. For starters, doctors say the virus is much less contagious. And as Hannah just mentioned, monkeypox is spread by skin contact, where COVID spreads through the air. And the other good news, we already have treatment options. Doctors say most pox viruses like smallpox, chickenpox, and monkeypox are very similar. So there is medication that is at least partially effective.